might be the key to fighting childhood cancer. A new research project is using zebrafish to identify the genetic and environmental factors that might lead to the development of childhood leukemia. And our very own OU Medical Center houses one of 10 labs in the U.S. to use zebrafish to study leukemia. Really interesting, groundbreaking stuff here. Joining us now to talk about this, Dr. J. Kimball Frazier with OU Medical Center, OU Health Sciences Center. Thank you so much for being here.
Pleasure.
Really, really unique and interesting, obviously very scientific and complicated. So try to give us kind of the Reader's Digest version, if you will, of how this even came to be and why zebrafish.
Sure. Well, it's a long story, but the short version is this is an affordable animal model that you can easily have hundreds or thousands of animals, and they're easy to genetically manipulate. So cancer, including leukemia, is a genetic disease. And you can engineer zebrafish, like we and other labs have done, such that they develop leukemia. And then you can learn a lot about which genes are important in causing leukemia and also which genes are important in defeating leukemia.
So it's not to say that these zebrafish are the cure to leukemia. You're using them to study leukemia, correct?
Well, they're an element of learning the machine.
Okay, awesome. And I read here, and I found this interesting, you always think of labs and you think of mice. So these are actually a more affordable option, and they're clear that you can use to study leukemia.
Yeah, for a substantial part of their lifetime, they're optically translucent, and so that allows you to see what's going on inside the animal without, requiring that you open them up and manipulate them in that way. So that's a big advantage that mammal models don't offer.
Sure. What are some of the biggest things that you've learned about the disease? Leukemia, by the way, the most common cancer in children and teens, accounting for almost 1 in every 3 of such cases. So leukemia being the most common among children and teenagers.
Yeah, it's our bread and butter. Leukemia and lymphoma are like the breast cancer and colon cancer of kids. So it's an important disease.
What is the main thing that you think you've learned from this study using the zebrafish?
Well, that's where it gets kind of complicated. And to dodge the jargon, I guess I would just say we've learned a lot about certain genes that before had not been implicated in causing leukemia, but now we've used zebrafish to learn that breaking these genes can promote leukemia development or promote leukemia advancing more rapidly or becoming resistant to certain therapies.
So leukemia could be something genetically inherited? Are you saying that?
Well, so it's been shown that a minor contribution of getting leukemia, or really any cancer, are genetic predispositions. But these are complicated multi-step events. And so while you may inherit a small chance of developing leukemia, the vast majority of people who inherit those tendencies don't go on to get leukemia. So really the biggest determinant is just bad luck.
Okay. And something else I read that was really interesting too is researchers are hoping to find out, using these fish, if a common pesticide is a trigger causing leukemia. What would be a pesticide that would be a trigger causing leukemia?
Well, you catch me a little off guard because I'm not familiar with that work specifically, but what I could tell you is that there are a lot of environmental toxins, and many of these things aren't overtly toxic like pesticides that you think of as intentionally killing things.
Sure.
But there are a lot of chemicals in the environment that we're all exposed to that seem harmless, but that can actually damage your DNA. And so that's one of the ways in which cigarette smoke, for example, or other seemingly harmless chemicals can actually promote you developing any kind of cancer, not just leukemia.
And so how does this work? I know a lot of this is going on, I believe it was Wayne State University, somewhere in Detroit, and but how did OU get involved in this, and how did your lab get involved in this huge study? And then how do you share your findings with the other scientists and other doctors throughout the country?
Well, the way I became involved with this type of work was when I was doing some of my clinical training, when I was doing pediatric oncology, what's called fellowship. I was at the University of Utah, and I joined a laboratory there that was already studying leukemia using zebrafish. This was almost exactly 10 years ago. And so really over the last 10 years, 4 of which have been spent at OU, I've been working on these projects. In terms of sharing the information, it's all done through publications in medical journals or occasional news interviews.
There you go. Maybe they're watching us right now. And lastly, just for you personally, dealing with children, obviously, who have cancer, you're dealing with these patients, you're seeing these patients. How do you have time to do that? And then also do research with zebrafish? I mean, they seem like very different jobs almost.
Yeah, they are. And it's a great question. Really, the way that I have the time to do this is by virtue of my colleagues. So I'm one of a group of 10 pediatric oncologists at OU Children's, and soon to be 12 or maybe even 13. So we're an expanding group. And it's really by virtue of my colleagues that I have the time to spend as much time in the lab as I do. I do some clinical work, but I don't share an equal clinical burden
Okay.
as some of my colleagues who are on the front lines all the time.
Okay. And lastly, for someone who's listening to this interview and they think, oh my gosh, this is revolutionary. They're using these zebrafish and they're able to research by the thousands instead of, just using one mouse. And I mean, it really is a revolutionary study, just reading briefly on it. What is the timeline? I mean, when could this move to kind of a human type trial where you're genetically modifying type things, or what would be the timeline based on this? When could these findings be implemented?
Sure. That's actually already happened.
It is happening.
Yeah.
Okay.
So it's a multi-step process to go from discovery in a laboratory to implementation on the clinical side.
Okay.
But probably globally, I would say that 10 years is a ballpark time frame from when you go to making a discovery about, in our case, the genetics of a disease, to maybe making some clinical change in how you manage the disease. Sometimes faster, sometimes slower. It depends a little bit on what you discover. But in terms of just classifying patients up front, you can move very quickly. So that's not necessarily a new therapy, but in the beginning, when a patient's first diagnosed, 20 years ago, many patients were sort of all put in the same category. Now we do a much better job of determining which patients from day one are at high risk of failure and which patients have a good chance of cure, and assigning them to an appropriate therapy based on that risk.
Okay. I mean, just revolutionary stuff, really life-changing stuff, and going on in our own backyard.
And it's fun too.
It is. I mean, good for you. I mean, changing lives here. Thank you so much for being with us, Dr. Frazier.
Pleasure.
With OU Health Sciences Center. Good luck. Thank
Thanks.
you so much for spending some time with us and shedding some light on this zebrafish study. I feel much smarter now that I researched some of this. Most of my time is spent reading about football or baseball. So.
Well, I spend a lot of time reading about football and baseball
Good
too.
for you. Good for you. Thank you so much for your time. We appreciate it.